Dr. Stephanie Bathurst joining us here. I cannot believe this is our number 5. Is that really true?
It is. It's going so quickly, isn't it?
It does. I'm excited to have you back and just, want to congratulate you. You were just awarded Outstanding Leadership Award in Health and are going to be be on the speaking panel. This is at the Health 2.0 conference in Las Vegas, July 10th through the 12th. Exciting!
It is. Thank you so much. Yeah, it's really exciting. We're really looking forward to being out there and networking with all of the big names in the business and getting to learn from them and just grow in the field.
Well, tell me about your business. I know, but there's new people tuning in. So tell us a little bit about what you do, and then we'll get to today's topics.
Sure, yeah. So I own a private practice called Bathurst Family Therapy. I'm a clinical sexologist and licensed marriage and family therapist. Our company offers Hawaiian couples retreats. We offer hybrid online programs for individuals, couples, and multi-partner relationships, and one-on-one coaching sessions to clients across the globe. We specialize in things like infidelity repair, in integrative medicine for mental health disorders, and really like pelvic floor health, which is what we're going to be talking about today.
So, yes, what is pelvic floor health even about? I mean, something I've experienced, but some people may not even know. Did you talk about that?
Yes, yeah. I mean, this is something that impacts every single person. If it hasn't impacted you yet, meaning some of our listeners, eventually it will, because it's impacted by aging, and we all can't prevent aging. If the term pelvic floor is brand new to any of you, think about all the muscles and the bones and connective tissue that help your lower sex organs function. We all have them, so today's conversation is not just for women. If any men have tuned in, stay put. This is going to be helpful for you as well. So as we age, our collagen production declines, and our bodies struggle to regenerate cells. And this impacts all of our bodily processes, but in particular, our pelvic floor functioning as well. So as long as we are aging, our pelvic health is declining, and we really want to really pay attention to it and manage its health.
I also point out, if someone doesn't really know what pelvic floor issues are, go on a trampoline. Feel how that feels. Because after I had my kids, I had, the pelvic prolapse. I've had all that. I think we talked about that a little bit, but go on a trampoline and you can feel what it feels like if something's bothering you. I think that's a good way to determine if you do have a problem. But the truth is, how do you keep it like that with the collagen? How do we build collagen to keep everything elastic and to kind of like keep things up? I mean, right? Because clearly that's, I'm unstable. Some people's are, pelvic floors are unstable.
Yeah, absolutely. And you're exactly right. Go on a trampoline, or even like if you're sitting down and you go from a sitting down position or a lying down position to a standing up, and you just feel like an intense pressure in the lower region, or even have difficulty activating those muscles to go from a sitting down to a standing up position. It's usually indicative of instability issues. So today, hopefully, is really helpful in guiding you to a direction of healing and repair. Our bodies all have their own way of communicating to us when something is wrong, and we just have to learn its language because it's a little bit different from what we're used to. So pelvic floor dysfunction in its own language, if we're experiencing recurring and progressive constipation, if we're straining to pass stool, or if we're having pain during or after sex, if we're experiencing sexual sensation reduction, or if any urine or stool is leaking when we're coughing, laughing, bending, pushing, really just any kind of pressure movement, or if we're experiencing really like urgent and frequent needs to pee, meaning if you're getting up multiple times throughout the night while you're sleeping just because you have to go to the bathroom, and it's not because of a temporary UTI, those are all signs that you are experiencing pelvic floor dysfunction, and we need to prioritize the maintenance of that. So this program that we're going to talk about today is especially useful for clients who are experiencing sleep disruption due to frequent trips to the bathroom, or really any of those symptoms and signs that I just talked about. our pelvic floor can be weakened by so many different things. And you had just mentioned pregnancy and childbirth, and 100, yeah, exactly. That's definitely like one of the primary causes, because pregnancy and childbirth, although it's a beautiful thing, is very traumatic on the body. It's a lot of change in a very quick period of time. So in addition to pregnancy and childbirth, reproductive cancer like prostate cancer treatment, obesity, we talked about constipation from poor nutrition, medication side effects, or medical issues. I mean, all of those things are really common, right, in the US. Super common. And we don't really have, when we talk about them with our friends or our family, the frequency in which our medical professionals have proactive conversations in response to those presenting issues about pelvic floor maintenance in the aftercare is very minimal, unfortunately. And it kind of speaks to the deprioritization for preventative care and treatment after injury, which is really shocking. And our pelvic floor is responsible for so much. We want to take care of it as much as we possibly can. It's responsible for sex, going to the bathroom, sitting and standing up, growing children, stabilizing and protecting your spine. These are important things.
My goodness, really, they are. Let's talk more about rehabilitation. How quickly should you start that, after childbirth?
Yeah, that's a perfect question, because it's actually really widely misunderstood. When you see a lot of doctors or you Google this information online, a lot of the recommendation is still to generally wait 6 to 8 weeks after childbirth before beginning a pelvic floor physical therapy program or healing and recovery program. And except for really severe prolapse cases, that's really inaccurate. The process of injury and physical trauma and the importance of immediacy in healing is no different in the reproductive areas than it is for something like a shoulder or a knee. Studies in sports medicine prove that the early treatment expedites recovery in early phases following injury, right? So the benefits are increased the quicker that you implement a healing protocol as immediate to the injury onset. So the reason for that is that it is much more difficult to rebuild atrophied muscles than it is to strengthen weakened ones, right? So barring the really severe cases, the short answer is start immediately. So I'm a certified Pfilates instructor, which is an evidence-based pelvic floor conditioning program developed by a urologist and a physical therapist. Pfilates, so it's not Pilates, which I also do, but it's Pfilates. It's a specific program that uses principles of plyometrics and the control of Pilates movements to increase pelvic floor activity. So the research has demonstrated that it can generate contractions in the pelvic floor up to 1,000% more in muscle activity than a simple Kegel exercise can do, which is amazing, right? So I know. This program is non-invasive, so it prevents many unnecessary surgeries. You don't even have to go into the office to do it. You can stay in your pajamas, in your living room, do it a couple times a week for 10 minutes a day. It's super fast acting, improvements within 28 days for almost all people. And it's self-guided training with 80% of cases fully being resolved in 3 months. That's amazing, right?
Yeah.
I know. Yeah, so for female sex clients who really struggle with feedback from their body, I can offer them an additional biofeedback tool, which is something like the Fem Flexor, which is kind of like a Kegel exercise inserter, right? It's a soft silicone pelvic floor exercise tool held within the vagina during exercises to provide biofeedback for musculature activation. So used together, you can experience really profound and quick responsivity between your body and your brain. So for people who are really disconnected between their body, this is something that helps pretty instantaneously, which is really cool.
What exactly do in this program? Sharing some more specifics on it? Thank you.
Yeah, absolutely. So we've boiled down the exercises that have been verified through research to activate your pelvic floor muscles the most. Which is cool because we've done all the hard work for clients. Out of the 10 that we've already boiled down that are statistically significant to activate the most, you only need to have like 2 or 3. So you can try out the 10 and pick out the ones that you like the most that don't create any kind of pain responses and use those in your programming. So we offer modifications for any kind of disabilities or chronic injuries that may present mobility issues. So it's really applicable to everyone. And what's cool is that you only, like I said, you only need 2 or 3 of these exercises. So even if you hate 8 of them and you never want to do them again, right? So if you hate like lunges or corkscrew or bridges, you don't have to do them. You can pick some of the other ones that are on the list. And have it still be effective and resolve your case within 3 months. So combining these with a specific breathing technique that helps you to activate your pelvic floor muscles at the exact same time that you're doing these exercise repetitions and holds. That's kind of the whole program in a nutshell if I were to grossly oversimplify it. And we do a sequence of each exercise repetition, breath, and hold a few times per day. And that's it. It's that simple.
You mentioned a breathing technique. Would you mind elaborating on that?
Yeah, sure. So we call this a percussive breath. Think about when your best friend tells you something hysterical and you're laughing so hard that your side or your stomach cramps. So you're doing core work, right? Like maybe you wake up the next day and you feel like you did a whole bunch of crunches that day. We end up teaching you a type of breath work that helps you do something very similar, but on command, right? At the same time that you're activating the pelvic floor muscles through these specific exercises. And what this breath work does is help you contract the muscles in your core by pulling your belly button in and up, targeting your transverse abdominis muscles, which are kind of like the V-shaped muscles around your bikini line. So this is purposed because our pelvic floor muscle groups, they're not made to be isolated and work without one another. They are built and made to be activated in synchrony and in synergy with one another. So this breath work, this breath technique helps you to kind of synchronize and experience activation of the full floor at the same time. Does that make sense?
It does.
Wonderful. Yeah, absolutely.
Perfect timing here to take a quick commercial break. So would you mind doing the honors, Mrs. Dr. Stephanie Bathurst, please?
Sure, absolutely. So I'm Dr. Stephanie Bathurst. I own a private practice here on Oahu, Hawaii, Bathurst Family Therapy, and we offer everything from 5-day couples retreats that are immersive and heavily focused on physical, sexual, and experiential intimacy to online hybrid programs for individual and couples healing to one-on-one coaching and therapy across the world. Yeah.
Well, thank you. We'll be right back after this. Looking forward to the rest of our conversation. Tuning in now, we're talking about floor conditions, how we can strengthen these muscles, and everyone can use some help and problems that come along with it, but there's good news out there. There is hope. Stand by.
If you have unfiled taxes or are in debt to the IRS, this is important news. The IRS just rolled out a new program to help struggling taxpayers more easily resolve their tax problems. It's called the Taxpayer Relief Initiative, and it opens up powerful new options for people looking to get back on the right track with the IRS. And no one knows this program like the professionals at Optima Tax Relief, America's most trusted tax resolution company. They've resolved over $1 billion million in tax debt for their clients and have the expertise and experience to help you. One easy call to Optima can start the process, helping to put an end to your worries of wage garnishment, asset seizure, and other aggressive IRS actions. Make today the beginning of your fresh start with the IRS. Call the experts at Optima Tax Relief now for your free confidential consultation.
Call 800-386-9945. 800-386-9945. 800-386-9945.
Optima Tax Relief.
Some restrictions apply. For complete details, please visit OptimaTaxRelief.com. Are you looking for even more of the podcasts and hosts that you love? The Podcast Business News Network is proud to announce that you now have even more ways to listen live. Check out the MyTuner Radio, online radio box, and Simple Radio apps on iOS and Android, or find us online. Search for Business News Network on mytuner-radio.com, or search Podcast Business News Network on streama.com and onlineradiobox.com/US. Take your podcast on the go and don't miss a minute of the action.
Are you looking for a great night in with your girlfriends and ready for an experience? Hi, my name is Tiffany Harvey, and I'm the CEO and founder of Pick Your Sweet Poison. We offer virtual mixology classes where you can learn to make your favorite drinks at home, and you'll never be far from a party with Pick Your Sweet Poison cocktail recipe box, which offers over 60 fun drink options to sip on all night. Book today on www.cocktailrecipes.fun. See you soon.
Broadcasting from the business capital of the world, this is the Podcast Business News Network.
Dr. Stephanie is here joining us from beautiful, but she's worked with you anywhere around the world, but who wouldn't want to work with you in?
Yes.
Right? Isn't that true?
Yeah, I do see people in person, so you're always welcome to fly out here and see me in person at my home office.
Awesome. Thank you. We were just talking about some important breathing techniques. Again, we're here for today's fifth podcast, and we're talking in regards to floor health, how she could be of service. So let's talk more about those exercises and techniques. Let's talk about how long do we have to do it for, if you don't mind?
Yeah, so this process is really simple. So typically I will meet with a new client once or twice, just so that we can make sure that they're doing the exercises appropriately. I'm answering any questions that they have. If I feel like there's instability in one particular exercise, I may ask them to maybe choose a different exercise. Just visually, safety is always priority. So have one session with me minimum, just to make sure that we're getting on track with the movements. And then it's really self-guided from there on out. If we're talking within the span of just 1 month, which, like we said earlier, most people, almost all clients, see improvements within the first 28 days with this evidence-based program. We only ask for 10 minutes a day in your home with whatever it is that you have around your house to use. So you don't have to purchase any major equipment. You can use a hand towel, a chair, a yoga mat, a living room carpet, whatever you have. It's that simple, but really that effective. So I think what we are, the purpose of Bruce Crawford and Heather Dibke, who are the two creators of Pilates, the purpose of this program and why it was developed was because there really wasn't an effective program out there that helped women in particular prevent invasive surgeries. There were really an abundance of unnecessary surgical mesh procedures, not just in the US, but across the world, happening on cases that were fairly mild or moderate and didn't really require it, but we didn't have alternatives to offer these women. So this is the alternative, right? So this provides no surgical mesh procedures, no feminine pads every single day, which is so common. That's something that is very normalized for women, aged 50 and older. No insurance approvals for physical therapy that you have to wait on, or having to drive into a clinic 3 times a week, which is a real barrier for a lot of people to treatment. So those are those are pretty amazing things for this exercise, which is a big reason why I opted to get certified as an instructor and offer this program in conjunction with a lot of my other clinical services. I know it's slightly different because this is more fitness and exercise based, but it is very much related because it flows synergistically together with a lot of the clinical sexology services that I do offer. When I have a male presenting client who comes in with premature ejaculation or other forms of ED, or if I have a female presenting client who comes in with sexual pain or mild organ prolapse that's causing just general discomfort and decreased quality of life, we're able to work together and heal the psychological, the relational, and the physical issues all together in one treatment plan and protocol, which is pretty amazing because these things these things impact all three of those life domains.
Thank you so much. This is just scratching the surface of the provide to so many people, and obviously, for some people, these can be uncomfortable conversations, right? And to you, it's not. To me, it's not. But some people may be embarrassed about these types of situations. How do you work with someone who's feeling uncomfortable about even talking about their struggles with this condition?
I think just normalizing it, right? So holding a space of conversation where I'm not like blushing or shying away from uncomfortable words. I'm holding the space and modeling comfortability in having these what feel like initially awkward conversations and helping them feel not so awkward. Because these are really important. And to be honest, these are very normal conversations. They just aren't normal to the typical public, right? These are taboo conversations, unfortunately, and we're trying to fight against that in the field. But I think me providing that kind of normalcy allows the receiving client to kind of settle into their comfortability with this conversation. Maybe not in entirety, right? We're working on that, but at least in the therapeutic space, we can kind of slide into that comfortability really easily. And then getting into the statistics of like how common prolapses are or how common instability is. And it's really unfortunate to see those numbers and just to know how common, right? Like some of our bodies are dysfunctioning and we find acceptance with the degree of that dysfunction and we live with it, and we don't have to, we shouldn't have to.
Well, thank you for making us feel comfortable about this, knowing there's, help. What else did you want to add?
I'm not much. I'm here to support. I'm here to help. I'm here to help spread education in whatever way that I can. I know that you had your own experience with pelvic floor instability and dysfunction that you've been super open about, which I have great appreciation and respect for, Jill. I think we all need people like that to be the advocates for the general public. So thank you so much. Do you have anything that you're wanting to share? Any questions that you have that I can support you with?
Thank you. Yeah. For those that may not know, new to the show, we talked about my first pregnancy and the second. No one ever told me that this could even happen. I come home from the hospital the next day. I'm like, what is coming out of my vagina? And it looks like an animal. I'm like, what is this? Lo and behold, did I not even know? Never was taught in any of the prenatal classes, maternity classes that I took about this pelvic floor situation. And guess what? Yeah, that was my cervix, my uterus, could have been the bladder. Everything was kind of prolapsed in a sense. And some people have it worse than others. Mine was there, just a little coming out. But some people have full, serious prolapse. And it really scared me. Now I have a baby I'm caring for. And all of a sudden I'm like, how am I going to walk? I feel like everything's falling out of me. How can I? And my mom was with me, helping me. And then, of course, I went right to the doctor and discovered this was the situation and panicked. It's a scary thing. How am I going to be a mom? I have to get up and walk, and I just felt like everything was falling out with me, and it was. And then after treatment, and I decided to go back to the doctor and learning more Kegels exercises. I told you they gave me that device. I forget what it's called. What is it again?
Oh, I don't know. What was it?
Oh, it's a device. It's kind of like a vibrator, believe it or not. It's supposed to stimulate the muscles, and you put it inside of you, and you sit in the office, and you connect to the machine for a while, like giving you like electric shock of some sort or vibration.
Like a TENS unit, an internal like TENS unit. Yeah.
Exactly. It's an internal TENS unit. Let's call it that. And it eventually helped. And then I had the second one. Same thing happened. And they told me I do need reconstruction eventually, but haven't done it yet. Just anyway. So yeah, I've been there, and it's uncomfortable. It's painful. It's embarrassing. Who wants to do anything? But it's so good to know that I'm not alone. And when you brought that up a few weeks ago, originally, I was like, oh my goodness, okay, this is normal. No one's ever really talked about it with me, and I'm so open. So I appreciate in the work that you're doing this. And then at the same time, the biggest thing was, well, I don't want to even have sex now. So then how do you explain that to your partner? It's not fun, and they don't understand at times. So speaking to someone like you would be a great thing if you're a couple, and having to speak to someone to learn the specifics, because not every spouse would understand,
Right, absolutely. And some people have, right, like 32% of women are going to experience a pelvic floor disorder in their lifetime, and 16% of men will experience one in their lifetime. But there are different ranges. There's a huge spectrum, and sometimes you can have hypotonic disorders, which means your muscles are too contracted, and it's painful because you can't let go, right? Which is when you have issues with like insertion. You can't put, right? Like that's a totally different issue than instability, where things are too loose or too lax and not activating. So even when we're talking about like empathy or being able to understand like the somatic sensations of our partner, it's really difficult if you haven't experienced that kind of like looseness or instability or the pressure that you feel. So it is helpful to have a mediator there to be able to describe it.
Oh, well, thank you for being here, for talking about this. And if we do want to reach out to you, could you share your contact information?
Absolutely. You can reach out to us via email at help@bathurstfamilytherapy.com or via phone at 215-501-7452. We're on Instagram, Facebook, LinkedIn. Find us at myflowtypes.com. You can take a free relational quiz. Feel free to reach out if you're ever wanting to schedule.
Thank you so much. Pleasure.
Thank you, Jill.
Stephanie, and have a fantastic weekend.
You as well.
Thanks again, and bye-bye.